Hey guys, Dr. Ray Marque here, and this is our latest edition of Dr. Ray TV. I'm your local chiropractor at Back Pain Relief Center. Today is, Tuesday, 31st. It's crazy. February is going to be here tomorrow. I'm kind of glad that, I'm ready for spring already. A few cold days and I'm getting ready for it. So this is a live edition, so if I stumble a little bit here and there, that's just part of it. Today I wanted to talk to you guys a little bit about chronic back pain. And the reason I wanted to talk to you about it is as soon as I woke up this morning, I had a coffee and I turned the TV on, and the first thing was a commercial, and I don't even remember what surgery center or what hospital for, but it was for low back surgery or lumbar surgery. And they had a patient, whether it was a real patient or not, saying, hey, I had this really bad back pain for a long time. I had surgery, now I feel great. Well, that may be well and true for that particular person, but I've been doing this quite a while now, and I've seen lots and lots of cases, and there's been some that have been great, and then there's been others that it really kind of turns into a nightmare when it comes to the back pain. And let's talk about that a little bit. Number one, it seems to me, and I guess this is just from a lot of feedback and from what I hear from a lot of other doctors, that it's a 50-50 chance on how you're going to feel when you're done. And I think there's a lot of good surgeons out there, and I think there is absolutely a time and a need for back surgery. I've sent many patients myself to go have a consultation and actually have the surgery myself. And for some, it does work well. So here's the thing. When they do a surgery, whether it's a laminectomy or a partial disc, where they're shaving parts of the disc off, or whatever they're doing there, if they're fusing it together, they always do, I shouldn't say always, from what I've seen, most of the time they do a great job at exactly what they say they're gonna do. The problem is when we look at a lumbar joint, there's many pain generators in that joint. So typically when they do what they say they're gonna do, they do a great job at it, but there may be other areas in that joint that are causing you pain. So maybe you had leg weakness, or you had neurological symptoms in your leg, or pain down your leg, and they do the surgery and that pain stops. And that's typically what happens, is they shave part of the disc off, or they take the disc out that's pushing on the nerve, and it stops that pain. But it doesn't stop the low back pain. The next problem when it comes to these things, and I don't want to say problem, I guess it's just how it is, when we fuse together or we disrupt the way that our bodies were designed to move or to function, it causes the rest of the body to start dysfunctioning. So say we fuse together L5-S1, which is very common. When we fuse those two joints together, the joints above it begin to dysfunction. That's what we typically see. So say you had a herniated disc at L5-S1. 5 years later, we have a herniated disc at L4, L5, and the patient's like, well, what happened? I had surgery. I thought this was all behind me. Well, what happens is when we disrupt the biomechanics of that lumbar spine, it starts a phase of degeneration that can affect the joints above it. So it's not that it was a failed surgery. The doctors probably did a great job at exactly what they were supposed to do, but it made the other one start to dysfunction, or maybe there was other pain generators that you're feeling pain from. So I guess my whole point in this thing with chronic pain is take a decision for back surgery very seriously, get a few opinions, make sure that it's the thing to do, okay? And I would try absolutely everything else before I would do that. If you can see me keep looking down, I'm looking at my notes, so I make sure that I stay on point here. So the next thing, what is everything? Well, let's talk about what we need to do to get the joint to work right in the first place to stop the pain or hopefully manage the pain. Number one, we need to decompress the joint. Almost all of us as we age, the disc space gets smaller, it degenerates, a natural part of aging, and the joint compresses. When it compresses, it works abnormally, it builds up scar tissue, it gets arthritic, it starts putting pressure on the nerves, and it gets tight and spasmed. We need to decompress that joint. Take pressure off the joint to allow it to have better range of motion. So that's the first thing. The next thing is we got to decrease inflammation. So if we're doing things in our life that are aggravating our back and we're feeling pain because it's being inflamed, we have to do things to keep that inflammation down. one thing is right back to what we just talked about. When we decompress a joint, it takes pressure off it. It's not so inflamed. We can do simple things at home like Advil, omega-3s. There's a whole host of nutritional things that you can do. I'm not an expert on the nutritional end of it, but I'm sure there are people out there that can help with inflammation. On the flip side of it, a consultation with your primary or with a good orthopedic and getting some appropriate medication to keep inflammation down. We need to stretch the tight muscles, so as we overwork our back or as our back degenerates, the muscles tend to spasm, they build up adhesions in them, they get tight, they have trigger points. We have to loosen all that up, because by loosening that up, that will decompress the joint, allow for better range of motion, and slow down the degenerative process. Okay? Now, you might be saying, well, I've had really bad back pain for 20 years or 10 years or whatever it is. I can't do any of that stuff. Absolutely you can. Everyone can do these things to a certain degree. Maybe you can't do it as much as someone else, but you can absolutely improve. Everybody has the room to improve these spinal joints. And this is all really getting back to the chronic thing to keep you off the surgeon's table. So the first thing I would do is decompress the joint, increase my range of motion, decrease inflammation, and stretch tight and adhesive muscles. Okay? How do we do all that? Number one, go see a chiropractor. Come in and let me take a look at you. So chiropractic's one way to do it. Chiropractors are specialists in spinal manipulative therapy, which is the number one way to decompress that joint, realign the joint, take the pressure off the muscles and the nerves, and get it to function and feel better. Okay? So I get it. Chiropractic's not for everyone, and that's okay. Some people, it helps tremendously. Other people, maybe it even makes worse. So if chiropractic's not it, let's try to go another direction. Try physical therapy. Get in to see a good physical therapist with goals of making your body function better. Not just strengthening my core or stretching my hamstrings. You want to get that lumbar spine to work better. Decompress it, increase range of motion, decrease inflammation, stretch out muscles. Okay, maybe that's the route you need to go. And really at that point, any manual therapy, if you can come up with a stretching routine at home that increases your range of motion, maybe you go get a couple of those rollers at the back rollers that you see that people use in yoga and things like that. Maybe you get some of those and you work on your back and that loosens up. You can always message me and I can give you a few tips on what to do at home for that. But one way or the other, everybody's trying to do the same thing. Everybody's trying to decompress the joint, decrease inflammation, increase range of motion, loosen tight and adhesive muscles. Okay? So you try all that stuff at first. Maybe in conjunction you use a pain management doctor or an orthopedic or your primary, and you get appropriate medication to help keep pain levels down, helps keep inflammation down. Again, doesn't have to be a narcotic, okay? I know there's a huge epidemic out there, and I'm not a big fan of sending patients for the narcotics, which I don't think too many of the good doctors are doing that too much anymore anyway. So appropriate medication. So on top of the physical or the manual therapy or chiropractic therapy you're doing, some appropriate medication in conjunction with that helps tremendously. Maybe you need a series of lumbar epidurals to keep inflammation down, and I would try a series of them. I wouldn't give up on any of it. The last thing that I would do, if I tried all that and I wasn't getting better, I was still tight, my joints were still compressed, I couldn't loosen my muscles, my pain levels were high, before I would try surgery, I would try manipulation under anesthesia. Manipulation under anesthesia is a procedure that I do in a surgical setting where we put the patient to sleep. We put them through a series of very aggressive stretches and range of motion techniques, manual therapy to break up adhesions in the joints and in the muscles to decompress your joint, loosen those tight muscles, and decrease inflammation. Very, very high success rate with manipulation under anesthesia. Again, it's the most physical form of physical therapy out there, chiropractic therapy, whatever you want to call it. But I would try, absolutely, I would try it before I would decide to go onto the surgeon's table. If you've tried all that and it still doesn't work, then maybe there is a time and place for that surgery, okay? I hope that helps a little bit. I hope that clears something up from someone out there. If you have any questions, please feel free to message me. on Facebook. You can always reach us at our websites. If you're down in South Carolina, it's murrellsinletchiropractic.com. Again, murrellsinletchiropractic.com. If you're one of my New Jersey friends, family, or patients watching this, it's backpainrc.com. Again, it's backpainrc.com. I'm in Murrells Inlet today, so if anyone watching this out there would like to stop in and get adjusted, or at least talk to me, please just stop in. I'm at the office today till 12:30, and I'll be back from 2:30 to 6. All right, and I think I just got a message here. Thanks. Disc replacement fusion. Yeah, hey Ken, if you're watching this about that disc replacement infusion, you may be a candidate for it now. Who knows? But if you ever want to talk about it, shoot me a message and we'll talk about it and see if there's anything else out there that could help. Again, everyone have a great day. I hope all is well, and I will talk to you soon. Bye-bye.